Women shoulder well over half of the burdens brought on by HIV/AIDS in developing countries. A complex web of practices and public policies leaves poor women and girls most vulnerable to the virus and all its entanglements. Macroeconomic policies and practices have a forceful impact on poor women in terms of HIV/AIDS. Women are important partners in the fight against all of the burdens brought on by HIV/AIDS. In India, HIV-positive women began a support group to help each other earn a living and achieve independence.
In Chennai, we started in this Positive Women Network, and the 4 women are widows. They don't have the husbands because of HIV, not anything else. They are become a widow. With our own resources, we didn't ask anybody to help us. We started like only we want to share in each other and then kind of support system. Out of 600 women living with HIV, 475 women are widows. And they don't have any earning skills or like income skills. We have to teach and everything to them. And they are earning and they are helping a family to grow. That's our government duty also, not only here in India, the same way in the government should teach beginning in the skills.
In Bolivia, economic discrimination drives needy women into the sex trade, making them vulnerable to HIV infection.
Muchas mujeres indígenas fueron empujadas a dedicarse a la prostitución con el grave problema de las infecciones de transmisión sexual o, en este caso, el SIDA. Los sectores más vulnerables han sido y siguen siendo las mujeres de las poblaciones indígenas.
Activists call on Bolivian policymakers to invest in building the capabilities of women to counteract discrimination and benefit national development.
Luchar contra la violencia de todo tipo, haciendo especial hincapié en la prevención del VIH-Sida y necesitan un oficio concreto que les permita vivir bien, darles las posibilidades económicas a las mujeres, el acceso al crédito y proyectos de desarrollo productivo que los puedan hacer a nivel individual o asociativo para poder ser autónomas económicamente.
Investments in women are a crucial part of national plans to stop the spread of HIV/AIDS. In Sierra Leone, Emily had to survive. Like so many other poor women and girls, she had no skills or education.
I used to go to the market, to walk around, to see that anyone that is interested in me, so I would sell my body for money to a man.
A private group is helping Emily and other girls learn job skills. If they had to pay user fees, these girls would be trapped in poverty. Healthcare, food, water, education and skills training, investments in women pay off in building human capabilities.
I think it's nice, huh?
Yes.
So I want you to do the same thing.
These investments ensure that women will live in dignity and be able to care for themselves and their children without resorting to the sex trade.
I'm planning, after doing my training in the estate, open a place, so I will do a business, so I will forget about the past that has happened to me in life.
Girls who are educated are less vulnerable to sexual exploitation. They tend to earn more money. They have more access to information and methods of self-protection. They hold a stronger social position and are better able to negotiate for safer sex. In this way, government investments in women's skills are direct investments in the prevention of HIV. Many governments have been shifting their obligations to provide public goods and services like water, healthcare, education, transportation to private corporations which demand payment from citizens.
With budget shortfalls, the advice coming from council outside of our shores, IMF, World Bank, etc., and including credit rating agencies, is that they have to cut back on some of their social spending. Cutbacks on health will have a deleterious impact on people suffering from HIV/AIDS, and cutbacks in, say, social security, or cutbacks in the provision of subsidized water and education also have an impact on the quality of life. And any cutbacks on social expenditure will impact on the lives of men and women very differently.
Because when people are not able to get healthcare treatment in the hospitals, when the hospital cost is high, when they have to pay user fees, they have to stay home and stop going to hospitals. And who takes care of them? Women. And this is why we are saying that it is very important that the process of macroeconomic policy take into account women's unpaid work.
Poor women and girls are often compelled to care for relatives living with HIV. They must sacrifice paying work or opportunities in school to work unpaid hours at home. This young woman from Namibia living in Senegal shares her experience caring for her relatives while managing her own life and HIV infection.
And it's very much tiring for me. And as a person living with HIV, it frustrates you because, the expenses is just too much. The workload is a lot. Carrying the buckets, having clean clothes, cooking for everybody. I took care of my sick cousin who had AIDS, and I had to do all these things. I was tired myself because I had to run for her medication. I had to make sure that she had good food. I had to make sure that the light was burning, the fire was at home, she had good beddings. I need to boil water for her every morning. I had to do all these things, and this whole process was on my shoulder, and it was frustrating for me because then I have to do all the chores. I have to make sure I have my own medication and her medication. I have to wash my own clothes and her clothes. Eventually she passed away. I'm here living with HIV yet, but still I have to do all these things every day.
Access to health is a human right. Access to water is a human right. The question of water also is quite linked to HIV and AIDS because we know that you need 10 buckets of water at least to care for a person living with HIV. Now, what happens to a woman who has to do the cooking, washing clothes, caring for her children, in addition to having to get additional 10 buckets of water a day to care for someone who is living with HIV?
Both in Namibia and in Senegal, antiretroviral medicines are free, but many other health services and medicine cost money.
Donc également, on a des activités dans le dépistage, notamment pour le dépistage du VIH/SIDA. Tous les services, non, tous les services, parce que quand une personne vient en consultation, il y a un ticket de consultation.
When women can't pay, they are forced to do without. Access to treatment is a significant problem in Mozambique. For those who can travel to the central clinic, treatment is free. Only a small percentage of the people in need can reach the treatment center. Most people live far away, and transportation is unavailable or much too expensive. Poverty prevents access to health care, even when the care itself is free.
So we need to have government that feel more accountable to the people, because whenever poverty increases, the care of poor people increase on the back of women, it creates the environment conducive to HIV and AIDS. Because in raised vulnerability, it increases openness to unsafe activities. It creates conditions for women not to have access to information, not to be able to purchase a female condom, and not to be able to have the power and the position to negotiate safe sex.
Large numbers of women and girls have no authority over their own bodies. This is aggravated in situations of conflict or war. Governments can invest in protecting women and girls from sexual assault. When women and girls are raped, they are especially vulnerable to HIV infection.
Nilikuwa mama wa kuvala na kukula, lakini leo nitabakia niko maskini. Ndio ugonjwa itaitika mwili yangu. Rebecca, simama. Angalia kule kwenye tuko wa mama. Mtoto ni wenyewe niliachiwa. Ndio mtoto wa yatima. Ndio.
In Kenya, Florence sings of losing her mother to HIV/AIDS. Her song cuts straight to the heart. Economists must listen with the heart and the intellect and integrate human rights principles in their approach. It is the critical duty of the economists to value this loss, to build policies and implement programs that compensate for the losses brought by HIV/AIDS and create economic plans to prevent and alleviate suffering for the greatest good. Government can nurture and encourage the enormous potential bound up in each woman and girl. Policies that support their needs for free education, skills training, and health care will shield them against the vortex of unpaid labor, poverty, and increased vulnerability to illness and untimely death.
The answer lies in building human capital, building expertise, training, providing the environment and the opportunity to be healthy and to be dignified. Development can be done differently. Development can be done to promote equality, to fight exclusion, and to give the women the power and the fruit of their labor back.
We must always remember we can prevent the spread of HIV/AIDS. Economically strong, educated, healthy women and girls are our best assets. We can build macroeconomic policy to do the right thing and the best thing for all people.
need a friend.